Bismillah ar-Rahman ar-Rahim. This is the first part of the talk, which will deal with the normal anatomy of the spine. And as you know from the previous sessions, we have certain steps in the evaluation of each part in the human body. The first one is how to prepare the patient for the examination, and it's almost fixed. If you are going to inject the patient with contrast material or give the patient some kind of anesthesia, then you should order the patient to fast for about 4 to 6 hours. Otherwise, there is no specific preparations for examination of the spine, either by CT or by MRI. Then the technique of examination, you put the patient in the supine position on the machine. Then you obtain what's known as the scanogram, which is the scout view for the spine. Then you start your sections, and the sections should be taken every 4 millimeters. And then you may ask when to inject the patient with contrast, and these are the indications. We usually give the patient contrast material in cases of postoperative disc surgery in the lumbar spine, and whenever we are suspecting inflammatory and neoplastic lesions of the spine. But we do not usually give contrast material whenever we are searching for disc lesions before surgery, in cases of spinal trauma, and in patients complaining of or suspected to have congenital anomalies in the spine. Then this is the scanogram of the lumbar spine. It is just similar to the X-ray lateral view of the lumbar spine, where you can count the vertebrae. This is the sacrum, L5, L4, L3. Then you specify the region of interest. And here we are scanning for the discs. Then you should align the angle of examination corresponding to the angle of the disc. And you tell the machine, I would like to scan the L12 disc from here, then you end here, then L23, L34, 45, then you scan L5S1 disc. And as you see, you changed the angle of examination, directing or aligning the angle exactly to the angle of the disc. And you should know why we do this in a moment. Then you obtain axial sections in the lumbar spine. We take the sections every 4 millimeters. In the cervical spine, because of the small size of the disc, we reduce the scanning distance to 2 millimeters every section. Then after the sections are projected on the screen, you should look at the sections in 2 windows. What we call the bone window, where you can see only the bone, you don't see the paravertebral soft tissue shadows, and the soft tissue window, where you can see the muscles, the cecal sac, the vessels anterior to the spine. Why we do this? Because there are certain items in the spine that are evaluated in this particular images, and other items in the spine are evaluated in this particular image, as we'll see in a moment. Then if you look to these images, these are the axial sections or the transverse sections in the spine. And if you have a newer scanner, you can order the scanner to reconstruct these images into a vertical image. And this vertical image may be sagittal, like this, or maybe a coronal, or maybe in the 3D appearance. Then this is the 2D reconstructed image of the lumbar spine, and this is a 3D reconstructed image of the lumbar spine. Here you can see a coronal reconstructed image for the cervical spine, a sagittal reconstructed image for the cervical spine, and this is the axial sections obtained normally by the CT machine. And here you can easily differentiate between the 3D images obtained by the CT machine and the 2D images also obtained by the CT machine. First, you obtain the axial images, then you order the machine to reconstruct the images in this way or in that way. Then, can you differentiate between the bone window and the soft tissue window? Yes. Here you can see the bones, but the soft tissues are masked. But here you see the soft tissues well projected, and also you can see some parts of the bony elements of the spine. At the time, there was an examination of the spine which was known as the myelography, where you inject contrast material inside the discecal sac. Then you perform a plain X-ray, and you can see the injected contrast material inside the discecal sac. And if the patient is normal, then you see the contrast material adherent to the posterior aspect of the vertebrae. But if there is a disc lesion, you can see the disc herniation indenting the contrast material within the cecal sac. After this technique, we proceeded with this technique, which is known as CT myelography. You inject the patient by the contrast material, you radiograph him by the conventional way, then you transfer the patient to the CT machine to obtain sections. Then you can see the cecal sac where the contrast material is seen inside the cecal sac, and you see these dots which represent the coda equina nerve roots cut in horizontal section. Also in the cervical spine, you can see the cervical cord surrounded by the contrast material injected inside the cecal sac. And this is CT myelography of the cervical spine. And you can see here a very large disc compressing the cord as well as compressing the contrast material around the cord. Then if you perform the scan for the spine, what are the items to be evaluated in the spine by CT and by MRI? We start first by CT. We would like to evaluate these important structures. Number one, you would like to evaluate the spinal canal, whether the patient had normal canal or a spinal canal stenosis. Then you would like to know something about disc lesions, if the patient had disc bulge, disc herniation, or disc degeneration. Then you go to the neural elements. You look to the facet joints, the neurocentral joints, and the sacroiliac joints. And at last, you look to the paravertebral soft tissue shadows for any abnormality in these issues. Then let us start by evaluation of the spinal canal. Then you may ask yourself, is the canal a bony structure or a soft tissue structure? This question is very important because if you say this is a bony structure, you should go for the bone window images for evaluation. If you decided that the canal is soft, then you go to the soft tissue images for evaluation. But you know that the canal is bony, and then you should evaluate the canal in the bone window images. How can you evaluate the canal? You just measure the diameter from you measure the diameter from anterior to posterior, then the machine will write a number here. And this is the dimension of the spinal canal. What is the normal dimension of the lumbar spinal canal? It is 13 millimeter or 1.3 centimeter. Then if you look to this diameter and it's 1.2, then you know that this canal is relatively stenotic. If you measure the diameter and it's only 1 centimeter, then this canal is also stenotic. But if you came here at L5 and you measure the diameter, it's 1.4, then this is normal spinal canal. And look for this, we measure the diameter of the spinal canal and it is 1.4 centimeter, then you say this is a normal spinal canal. Then you go to evaluation of the disc. You know, we scan the disc from here to here, and some of the sections pass in the vertebral body, some of the sections will pass in the disc, and the other sections will pass in the vertebral body below. Then how can you select the image for evaluation? You start asking yourself first, is the disc a bony structure or a soft tissue structure? It is a soft tissue structure. Then you should select the soft tissue window images for evaluation. Then which of these images is suitable for assessment of the disc? It is the section that has passed exactly in the disc. How can you know the section that has passed exactly in the disc? By comparing the density of the disc by the density of the paravertebral muscles. Because the disc is a soft tissue structure, the muscles are soft tissue structures, then they almost look similar. And if you look here, this is the vertebral body. And if you look here, this is part of the disc and part of the vertebral body. If you did not align the angle of examination corresponding to the disc angle, you will got all the images like this. Part of the image is formed by disc and part of the image is formed by bone. And these are not suitable for evaluation. You select the image which is almost totally formed by the disc material. Then you go to the soft tissue window images, you go to the level inside the disc, then you look to the posterior border of the disc. Normally, the posterior border of the disc should be concave. And if you see a disc with a straight border or convex border, this is abnormal disc. And we'll see in the second part of this talk what do we mean by abnormal disc. Then if you look to this disc and you can see the posterior border of the disc which is concave, and this is normal disc. But the posterior border of the disc here is not concave, and this is a pathologic disc. Then if you look to this disc at L12 level, then you can see the concavity, this is normal. And here you can see minor concavity, it is also normal. But here you see a big convexity inside the spinal canal, and this is a pathological disc. At L5S1, because this disc is the last in the spine, and it is subjected for the whole weight of the body, then you can allow the L5 disc, the posterior aspect of L5S1 disc, to be normally convex. Then if you, how can you know whether this disc is normal or it is pathologic? Here are the sections at L5S1. You came to this level and you see the L5S1 disc and you look to the posterior border. The posterior border is convex. Then how can you know this is normal or pathologic? You look to the next section. If you still see a disc material inside the spinal canal, this is pathologic disc. But in the next section, if you don't see any disc material inside the spinal canal, this is normal disc. This is especially at L5S1 level only. And in this case, do you see a disc material inside the spinal canal? No, because this appearance is bone. It is not like the muscles, not like the rest of the disc. But if you look for this, you see L5S1 and you see disc material with convex posterior margin. Then you go to the next section and you still see disc material inside the spinal canal, and this is a pathologic disc. Okay, and you see another example. This is L5S1 with convex posterior margin. In the next section you can see the L5S1 with convex posterior margin, and this is pathologic disc. Then you go to the assessment of the facet joints. What are the facet joints? You know the vertebra above, there is a descending facet. From the vertebra below, there is ascending facet, and they articulate together. If you have a section at this level, you will see the facet joint like this. Part of the vertebra below and part of the vertebra above forming this articular facet. What are you looking for in this articular facet? First, this articular facet is a bony structure. Then you evaluate in the bone window images. Then you look for, the only pathology here is osteoarthritis. And this is the normal joint, and this is the osteoarthritic joint. You see, the joint space is narrowed, the surfaces are irregular, and you may see osteophytes, and you may see air inside the joint space, what we call the vacuum phenomenon, which means advanced degeneration of the joint. In the cervical spine, you got another joint which is not present in the lumbar spine. That is the neurocentral joint, which means articulation between the vertebral bodies. If you have a section at this level, you can see the neurocentral joint on the left side, the neurocentral joint on the right side. And here you can see the facet joint on the left and right side. And you see this space which represents the neural foramen, where the nerve root comes from inside the spinal canal and go outside the spinal canal through this foramen. In cases you have osteoarthritis of the neurocentral joint, then you see narrowing of the joint space, osteophytes that markedly narrowed the joint, the nerve root canal compared to the patent nerve root canal on the opposite side. Then how to look to the cervical disc. In the cervical spine, this is the disc, and you should accept some bone cut within the same section of the disc, because the disc spaces in the cervical spine are narrow and small. Then you look to the posterior edge of the bone. You should not see any disc material here. This is normal. But if you see disc material beyond the edge of the bone, this is pathologic disc. Then look here, this is C5, 6 disc, and you got some disc material posterior to the edge of the bone. This is pathologic disc. And here C6, 7 level, you do not see disc material posterior to the edge of the bone, and this is normal disc. Then few words about the MR, which is more sensitive and can facilitate easily the examination of the spine. And you know we have the closed MR machine and the open MR machine. And this is the what we call the extremity machine. It is not suitable for examination of the spine, but it is suitable for examination of the limbs, like this you can see. And you may know a very recent machine introduced in the clinical practice, which is known as the dynamic MRI. What do we mean by dynamic MRI? That this machine facilitates examination of the patient in the erect position. And you see here the patient is erect, and the magnet is on either side of the patient, and the semi-recumbent and the recumbent. What is the value of this machine, which is very important in the spine? Look at this spine after surgery for disc lesion. And this is the examination of the patient while lying down. Let us look at the examination after the patient is stand. And this is the weight-bearing spine, and you see the marked disalignment of the vertebrae that was not apparent while the patient was in the spine position. Also look for this in the cervical spine. While the patient in the neutral position, you see only one disc level. But after the patient extends her neck, and you got 2 disc lesions. Also, the ligamenta flava are hypertrophied, indenting the cord from its posterior aspect. How to look to the MRI of the spine? You should first differentiate between what we call the T1 weighted image and the T2 weighted image. And I have explained some of the physical principles behind this terminology. It is not the time will not allow to repeat this explanation, but I would like you to know that if you see the fluids black, this is T1. If the fluids are bright, this is T2. And you know the disc contains fluid, and the normal disc should be black in the T1 and should be bright in the T2. These discs are not normal. Look at that. If you see the CSF, which is black, this is T1. The CSF is bright, this is T2. The disc is black, this is T1. The disc is bright, this is T2. Then the spine is examined by MRI in the sagittal plane, and you have T1 and T2. And in the axial plane, and you have T1, the CSF is black, and you have T2, the CSF is bright. This is the protocol of a spinal examination by MRI. Then, what do you think about these images? Yes, these are the sagittal images in the lumbar spine, and the T2 weighted image. The CSF is bright, and the intervertebral discs are also bright. Then, what you call this image? Okay. This is T2 because the CSF inside the cecal sac is bright, and this is axial T2 weighted image. Okay. Then the newer CT machines, as I have I just told you, can produce these images, which are sagittal reconstructed images. How can you discriminate between the CT image in the sagittal plane and the MRI? It's an easy for the radiologist and also for the clinicians. Just look to the vertebral end plate, and the vertebral end plate is black in all MR images. The vertebral end plate is dense in all CT images. then you know that the bones are dense in the CT and the bones are gray in the MRI. But refer only to the cortex of the bone or the vertebral end plate. This is very important to discriminate between the CT images and the MRI images. Then what are the items to be evaluated by MRI in the spine? You look to the spinal canal, like CT. You look to the intervertebral discs, like CT. And you look to the paravertebral soft tissue shadows, like CT. But there are two issues which are specific for MRI and cannot be evaluated by CT. These are the spinal cord and the bone marrow. These two issues cannot be evaluated by CT, but they are specific for MRI. Let us start by the spinal canal. How to know that this spinal canal is normal or this spinal canal is stenotic? You can see two patients here. Can you discriminate between the normal canal and the stenotic canal? Yes, this one is stenotic and this one is normal. How can you know? And you see the spinal canal is filled by CSF, and you see the coda equina nerve roots are surrounded by adequate amount of CSF. But here you see the coda equina nerve roots are running in a very narrow canal and there is no adequate CSF around. This is the way how to discriminate between the stenotic canal and the normal canal. Okay, can you measure the diameter of the canal? Is exactly similar to the CT, and the normal canal diameter is 1.3 centimeter in diameter. Then if you look here, this is a T1, this is a T2 weighted image, and you can easily measure the diameter of the spinal canal. This is a canal normal, adequate CSF inside the spinal canal. What about the cervical spinal canal? This is the spinal cord inside the spinal canal. What do you say about this? Is this T1 or T2? This is T2 because the CSF is bright. Then you go to the sagittal T2 in the cervical spine. Normally, you should see CSF anterior to the cord and the CSF posterior to the cord. Okay? Then, if you go to these images, in this case, you see CSF anterior and CSF posterior to the cord. This is normal. But here you see CSF only anterior to the cord, and this is mild canal stenosis. In the second case, you do not see CSF anterior nor posterior to the cord, and this is a more advanced degree of spinal canal stenosis. Then, how to look to the discs? You look in the T1 and in the T2. Normally, the disc in the T1 is black because of the water content, and the T2, the disc is bright. But if you look to the disc in the T2 and it's black, this means that the disc has lost its water content and the disc is now degenerated. This is number one. Number two, the normal disc does not extend beyond the vertebral edge into the spinal canal. Then this is the normal disc, this is the normal disc, but here you see the disc is extending beyond the vertebral edge into the spinal canal, and this means that this disc is prolapsing inside the spinal canal. Then what do you say about this? You see, this is a normal disc, this is a normal disc, this is a starting degenerated disc and bulging inside the spinal canal. This is a degenerated disc extending inside the spinal canal, and this is also a degenerated disc extending inside the spinal canal. Then in the cervical spine, the same. These are the vertebral discs containing a little amount of water. They are bright in the T2 weighted image. And they do not extend inside the spinal canal beyond the vertebral edge. Then, what about the spinal cord, which is specific for MRI? The spinal cord is almost similar to the brain tissue. It is gray in the T1 weighted image and more dark in the T2 weighted image. This is the normal appearance of the cervical spinal cord. Then, the last issue is about the paravertebral shadows. Normally, while assessing the spine for disc lesions, the paravertebral shadows are normal. They do not show any evidence of pathology. But in cases of trauma, you may see fracture of the spine surrounded by hematoma. In cases of infection, you may see inflammatory changes surrounded by abscesses. In cases of tumors, you see the vertebra and a tumor which is projecting in the paravertebral shadows. That is to say, while commenting on the paravertebral shadows in cases examined only for disc lesions, the paravertebral shadows are within norm. Then these are the few quiz cases just for testing the knowledge. What do you say about this? This is MRI, number one, and this is cervical spine, number two, and this is sagittal image, and this is T2 weighted image, okay? Then this is MRI, sagittal T2 of the cervical spine. Do you see any pathology? Sorry? The CSF anterior and posterior to the cord is okay. Then this, it is, no, because you see anterior to the cord there is CSF, posterior to the cord there is CSF, the spinal canal is okay. If one of these CSF spaces is lost, then starting the canal stenosis. This is the normal cervical spine. Okay, what do you say about this? Is it CT or MRI? CT scan at the level of L5S1. What do you think about L5S1? Is it normal or pathologic? Yeah? Pathologic. You see a disc material inside the spinal canal. The next section you see a very big disc material inside the spinal canal. And this is a CT soft tissue window, and this is L5S1 pathologic disc. What do you say about this? MRI, lumbar spine, sagittal, T2 weighted image. Then this is the right, MRI, sagittal, T2 weighted image of the lumbar spine. Is there any pathology? Yes, L4-5 is degenerated, L5S1 is degenerated. How do you know? Because the disc lost its water content and is now black in the T2 weighted image. How you count the discs? You just identify the sacrum, then this is L5, L4, L3, L2, and so. Then you have degenerated L4-5 and L5S1 discs. What do you think about this? CT or MRI? CT. Which part of the body? Lumbar spine. At the level of L3-4 disc. What do you think about this disc? Normal. Okay. This is a CT soft tissue window at L3-4 disc, and you see the posterior edge of the disc is concave. Then you are dealing with the normal L3-4. What do you think about this? MRI. Which part? T1, lumbar spine, sagittal view. Okay. Then, do you see a pathology? And canal stenosis is judged in the midline image, and you see adequate CSF space, but be careful. You should judge for the canal stenosis in the T2 weighted image, where the CSF is bright, then you can see the nerve roots and you can see everything in the anatomy. Okay? Then this is normal lumbar spine L1. What do you think about this? CT, a reconstructed image. This is true. In the coronal view, you see the lumbar spine, you look to the vertebral end plates, they are dense, and this is the CT coronal reconstruction and showing normal findings. What do you think about this? CT, which part? Lumbar spine at L3-4 level. What do you think? Yes, this disc is not normal. We'll talk about bulge and degeneration later in this day. And then you see the posterior edge of the disc is not concave. This is pathologic disc, and this is the CT of L4-5 diffuse disc bulge. We'll say about this. What do you think about that? CT of the lumbar spine, measuring the diameter of the spinal canal, and here is 1.1, here is 1.2. Yes, the spinal canal is narrowed at both levels. This is CT bone window, and this is spinal canal stenosis. And thank you very much. Do you have questions?